Um, we started planning this quite a bit before this latest war started. And what we were looking to do is to commemorate and highlight achievements and accomplishments of women in the labor union sector. So since everything has changed in terms of war and all of that, so we'll be potentially integrating some of that into our remarks. International Women's Day was first starting to be organized in the early 1900s by workers' movements, socialist movements, and unions were a beacon for highlighting social justice and looking at ending discrimination, violence, and inequality. Some of the kinds of activities unions have been active in voting rights, very important now, also labor rights, and absolutely social justice. Um, the spirit that we're offering tonight's talks in is something I read earlier today. No longer will I accept the things I cannot change. I will change the things I cannot accept. So this is going to be a theme running through all of this. Let me go into just a little bit of housekeeping, and then we'll introduce our panelists. Folks will be on mute except for our speakers. Please use the chat. If you have comments or questions, it will be monitored by our colleague Bonnie. Our group is called Seeking Women's Health Justice, and there will be a discussion following the presentations. And a little added benefit is that you'll get a resource list, a page long of resources that are mentioned tonight by the speakers. So that will be coming to you in a couple days after this. One of the things that MAPA often talks about is that every dollar spent on war is a dollar not spent on things like healthcare, education, veterans. We could have a long list here. The obscenity of this war is that the estimate on the daily cost just for US participation is $1 billion. And that's what we know. So we don't know what we don't know, but at least we're looking at that. So for every $1 billion that are spent every day, we're not funding kids' school lunches. We're not funding certain community programs, Medicare benefits, Medicaid benefits. And so this is the context that we're looking at this year. So, and we know the current administration is not a fan of unions. And all you have to do is read Project 2025 to see how hateful the actions by the administration could be to unions. Project 2025 outlines certain steps. For instance, states could ban unions in the private sector. They could make it easier for corporations to fire workers who organize. And it could even let employers out of contracts with unions that are already in place. It would eliminate overtime protection, ignore minimum wage, and merit-based hiring. And one of the very frightening things that I have read into Project 2025 is that it would weaken child labor protection and even let children do dangerous jobs with their parents' permission. So we'll be learning a lot tonight from our speakers. And as we're listening to them, I want you to think about how do we transform that into action? So, we need to first get our mental capacities fortified, and then we can figure out how we want to move along with this. Let me introduce now our two speakers. First, we'll hear from Elizabeth Pellerito, who's the Director for Labor Education Program at the University of Mass Lowell. She's in Portugal right at this moment. She's a labor educator known for her work in labor studies and union organizing. As a labor educator, she focuses on training and organizing all university employees on leading labor issues. She's active on the board of the Bread and Roses Heritage Festival, the Public Higher Education Network of Massachusetts, and the Women's Institute for Leadership Development. She combines labor studies with issues that intersect public health and worker well-being, especially regarding safety, health, and workplace risk topics. Our second speaker, Katie Murphy, is the president of the Massachusetts Nurses Association, the MNA. It's the largest union and professional association for registered nurses and healthcare professionals in Massachusetts, and it includes members across hospitals, clinics, and other healthcare settings. These are throughout Massachusetts. She is active in advocating for safe staffing as well as equitable healthcare policy. She served on the MNA board of directors for over a decade, helping shape organizational strategy and representation. And she is a strong proponent for healthcare workers, patients, and women on multiple fronts. So welcome to you both. Elizabeth, the floor is yours.
Thank you so much, Elizabeth, and all the folks at MAPA, particularly Catherine, who was great in building this webinar. So I'm really excited. And what I'm going to be doing today is giving kind of a big picture and making sure that everybody's on the same page about what unions do. I think a lot of us know about unions in the abstract, but don't necessarily know what that actually looks like on the ground. And then I'm going to be giving some historical examples of unions, mostly Massachusetts-based, but not entirely, who have done some work in various areas that match up with women's health equity. And then I'll pass it to Katie, who's going to talk more specifically about what the mass nurses are doing right now and some of the amazing campaigns that they've led recently and in the present. So just so we all know what it is that unions actually do, we organize. So we make sure that workers who aren't represented are in unions. And when workers are in unions, we spend time developing them as leaders to have a democratic voice in their union and in their workplace, their democratic organizations. Unions represent workers, and this is really important. This is what makes a union different than a club, right? The union has a legal relationship with workers, and they are the sole legal representative to bargain with an employer. They file grievances, they solve problems at work, and they bargain contracts that last usually 1 to 3 years. And those contracts are legally binding. Usually they have a resolution process that ends with a third-party arbitrator. So when you have a problem at work, somebody outside the workplace is making that decision. When you're not in a union, usually the sole decider is someone in HR who works for the company. So unions give us that opportunity to seek outside counsel. And then unions take action. This is the bread and butter of what we do. And this is really where workers' power comes from. So that can be taking collective action on the job. It can be taking political action, and we're going to look at some of that. And building solidarity within their unions, but also across unions and with other community groups. And it's helpful to remember that actually right now, only 10% of US workers are in a union. It's really only 5% in the public sector and quite in the private sector, I'm sorry, and quite a bit higher in the public sector. But we're talking about a small percentage of workers, and a lot of that is due to 50, some would say 80 years of attacks on workers, legal attacks on workers and on their rights to organize. So it's important to kind of remember that context. And one of the most important things that we talk about right off the bat when we think about women in unions is the gender pay gap. I had a student in my labor studies class a few years ago, last year, who was lovely. He was a retired gentleman who was coming back to college because he wanted to work in a VA clinic. And he very confidently said, well, there's no such thing as the gender pay gap. Women don't get paid less. And I said, okay, like tell me about that. Tell me about your experiences. And he said, well, I was a firefighter and everybody started at the same wage in my company. And I said, why did they start at the same wage? And he said, because our union contract said everybody had to start. And then he said, oh. So union contracts are one of our really important tools to narrow the pay gap. And it doesn't mean that it doesn't still exist. It's complicated. It has to do with maternity leave and taking time out of the workforce. But really, um, for women in unions, the pay gap is 87% of what men in unions make. For non-union women, it's 82% of what non-union men make. Um, and union women overall have wages that are quite a bit higher, 21% more. So a really substantial increase in pay than non-union women. And when we talk about the pay gap, we usually also break it down in terms of gender and ethnicity. And across the board, women in every category of race and ethnicity are making more than their non-union counterparts. And in addition, along with pay, we can also think about benefits. So women are much more likely to have health and pension benefits when they're in a union. They're more likely to have paid holidays and vacations. They're more likely to have life and disability insurance. And only 9.5% of working women are union members. What does this have to do with health equity? I think we all know, what happens when you have more money to spend, you have a higher quality of living. In sociology, we talk about social determinants of health. And it's not just about your genetics, right? It's about your social positionality, your social class. When you're making more money, you have more disposable income. And in a system where our healthcare is tied, unfortunately, to our jobs, that means that women who have better healthcare benefits, more healthcare benefits, are going to have positive impacts on their health and their family's health. Um, the other piece, so I mentioned that our union contracts are legally binding. They can't be changed without the consent of both parties at the bargaining table. And some of the ways that we address health of women and men, really, in unions can be things like our benefits packages, including benefits for children and dependents, retirement funds, non-discrimination clauses, and I'll talk about a number of these in a little bit more detail in a minute. So, protection from harassment and discrimination based on gender, based on someone's sexuality, and then based on how you express your gender. Um, we think about health and safety at work, so literally the ability to work without getting injured on the job. And these days we think about that health and safety as both physical health and safety as well as mental health. So often when we think about violence, gender-based violence at work and harassment at work, we're talking about health and safety clauses. And I know Katie's going to talk a lot more about that. Pregnancy protections, the ability to have maternity leave, the ability to have paternity leave, so that both parents are taking care of a new child, um, paid family medical leave, which we have here in Massachusetts, paid sick time. And then there's a lot of benefits that folks have been developing toolkits to be able to support trans women and trans men. So leave when you are undergoing medical and social transition, access to gender neutral bathrooms, things like that. So we have this whole host of benefits that are guaranteed in a contract that can't be taken away if a new manager comes in or somebody else owns the company. All of these are written and legally guaranteed through the contract. So this is an incredibly powerful tool. I'm going to spend a few minutes now talking about some historical examples of how women in unions and workers' organizations have fought for the right to greater health equity. And I'm going to start in the city where I live, Lowell, Massachusetts. And so in Lowell, it's a planned community. It's a textile community that is formed after folks travel to England, see the machines and the textile industry there, bring it back and say, we're going to plan a community of workers. We're going to recruit women from nearby farms because they're going to be easy to control and we can pay them less. So they think. And lo and behold, in 1830s, we have a number of strikes of primarily women workforce in response to pay cuts. And these are really teenage women who are coming together to do this. They are some of the first strikes in the United States. So really kind of very, very early in the formal labor movement. And not only do the women in Lowell walk off the job in response to lowered pay, they also, those strikes fail. Management fires them, brings in new workers, refuses to give them higher wages. And so the women in response organize politically. And we constantly see this tension, right, between political activity that unions are doing and pushing for laws that benefit everybody, and strike activity. So walking off and creating opportunities for increases in pay and benefits and justice for workers in a particular industry that then will have ripple effects to others in that same industry and beyond. So in 1845, the women in Lowell formed the Lowell Female Labor Reform Association. Um, they are very interested in who is getting elected. They don't have, of course, they don't have the right to vote at this time, but they are pamphleting, they're collecting signatures, and they're writing legislators and saying, we want a workday that is only 10 hours. We cannot work 14 and 16-hour days. And ultimately, these campaigns didn't win. They didn't get the law passed. New Hampshire, believe it or not, actually passes a 10-hour workday before Massachusetts does. But this really kind of laid the groundwork for a new kind of labor organizing across New England and across US industry, as well as workers explicitly pushing for political action, even workers who don't have the right to vote. Um, Fast forward a little bit to same industry, the textile industries in the 1910s, and we see what labor historians call the Protocol of Peace happening in New York. And this comes about because workers in sweatshops who are where the Lowell workers were making fabric, these are workers who were sewing ready-made clothes. Um, so 50,000 workers who are organized with the International Ladies Garment Workers Union strike all across the city. So not just one boss, but they have basically a general strike. They call others out. 50,000 young, largely immigrant women coming together and walking off the job. And what they were able to gain, these workers were successful, and what they were able to gain was essentially a joint committee with management that was called the Joint Board of Sanitary Control, that was in charge of health and safety in the plants and in terms of piecework at home. Um, they won a what we call in the labor world a closed shop, which means that employers would say, we are only going to hire workers who are part of the union. Everyone who works for us will be part of the union. And in exchange, those workers said, okay, we're not going to call these tens of thousands of workers out on strike while we have a contract. And it also brings in this third party arbitration. So we're going to go to someone who doesn't work for the company owner to settle disputes between workers and management. So again, we call this protocols of peace, and it's a really important moment for how we understand labor law in the US, but also in terms of thinking about health and safety. And we often see kind of joint labor management, health and safety committees today in unions to say, like, who knows better about what is going wrong on the factory floor or the plant floor than the workers who are experiencing this day to day. And so there's a direct ongoing committee that's addressing those issues. Um, I'm going to fast forward again. I'm kind of dipping in and out of a lot of years of history for you. I want to talk for a couple minutes about personal care attendants. So Katie's going to talk about nurses in usually in hospitals or sometimes like congregate care facilities. I'm going to talk about workers who are in the home. The home of a private person is their workplace. In Massachusetts, we call these PCAs or personal care attendants. Um, and really, the moment when we start to see this as an actual like occupation that people are talking about and making laws about is during the Great Depression. And largely, who are the folks who are doing this work? It is folks who are formerly enslaved themselves or the descendants of formerly enslaved women, the descendants of enslaved women, and immigrant women as well. So we see a lot of Black and Mexican American women who are actually getting paid through some of Roosevelt's programs through the WPA to be a home health aide for either the elderly or folks with disabilities. And then in the 60s, we get the Medicare system formalized to create a system of home health care support paid with public funds. And throughout our American history, it is largely Black women and immigrant women who have been in these positions. And an important thing to say, to go back a slide, one of the things that comes out of these massive strike waves of the 1910s and 1920s is the New Deal kind of backbone of labor law. So workers in the private sector gained the right to organize in the 1930s with the National Labor Relations Act, which is under threat today because of a lawsuit by SpaceX, Trader Joe's, Whole Foods, Starbucks, and Amazon. But so that core 1930s law that gives the right to organize writes out agricultural workers, farm workers, and domestic workers, personal care attendants,
And
folks,
healthcare workers.
um, and so folks who, again, are descendants of enslaved people are written out of the labor protections that we have. So here in Massachusetts, we have two kind of founding mothers who were doing a lot of organizing in this area. One of them, if you live in Boston, you probably know the name, Melnea Cass. She founded the Women's Service Club and began a training program to provide professional training, certification, education, and legal knowledge of their rights to domestic workers. And in 1970, Massachusetts is the first state in the nation to say that domestic workers have the rights, many of the rights of other workers that had initially been denied them in the National Labor Relations Act. And Geneva Evans, born in 1941, and she just passed a few years ago, carries on the work of Melnea Cass. And builds the Council of Elders, which is a senior center, but she begins to actually organize home care workers into the United Labor Union's Local 1475. And that union is made up of Boston's 5 largest home care agencies, and those workers have formal bargaining rights for the first time. And so when we look at the work of Local 1475, it is largely Black and Brown women, largely immigrants. They have a beautiful community culture of taking care of each other. And they have a 3-week strike in 1982 and really spur home care organizing around the country. And so this is a really important moment because not only are we thinking about the health and prioritizing the health of these very low wage, very vulnerable workers, but there's also a way in which they're building bridges with folks who are receiving that care. So they are doing the actual work of taking care and providing health benefits for folks who are at home, who are elderly, who are disabled. And they're building a movement of solidarity between that group of folks who are receiving care and the folks who are providing care, to advocate for health equity for all of those folks together. Um, on the other side of the bill, we think about the domestic workers, which would include housekeepers, caretakers, anybody who is doing work that's not providing direct health services. And in 2014, a group of workers were able to win the Domestic Workers Bill of Rights, which provides a lot of protection, in particular for immigrant and undocumented workers in Massachusetts. And basically makes domestic workers employees rather than independent contractors. So gives them the right to organize, gives them protections against sexual harassment, health and safety violations, all of these things. Okay, I'm going to speed up a little bit looking at the time. So when we think about pregnancy leave, many of you probably know the Family and Medical Leave Act carves out a lot of workers, and it doesn't actually give you paid leave. It gives you the right to take time away from your job without losing your job, but it doesn't pay you. And a 2022 study found that women in unions actually are significantly more likely to take advantage of their maternity leave, than non-union women. And part of the reason for that is because women in unions are more likely to have paid maternity leave. They're more likely to understand their right to take that leave. And then they have someone on their side who's helping them to navigate those benefit systems. And of course, here in Massachusetts, we also have paid family and medical leave, which is a huge, very recent step forward. Um, we have historically we see 1199 SEIU when abortion becomes legalized actually uses their member benefit fund to pay for women to get abortions. And on the other side of that, they are fighting against waves of unjust sterilization, that are primarily aimed at very poor women, Puerto Rican women, and Black women. Um, and there's unions today who are working in this same space. So the Communication Workers of America and the News Guild has a really robust abortion access toolkit that they actually put together when Roe v. Wade was overturned, for workers who are in unions to say, here are the policies that you can negotiate for, to make sure that you continue to have access to reproductive justice. Similarly, so Pride at Work is a group across unions of workers who are advocating for LGBTQ workers, and they have a toolkit online that you can access, that is, and there are a number of these actually, that is collective bargaining, ideas for protecting and supporting trans workers. So making sure they have access to gender affirming health care, that they have leave during transition, that they have access to fertility benefits, the ability to express themselves and to use the bathroom that best supports their gender. Let's see. And okay, I'll stop there. One thing I didn't include is some of the fights against sexual harassment. So there are a couple of unions there's a hotel workers union in Chicago and a janitors union in California that are doing really great work about creating really robust systems of protection in jobs that are notoriously make workers very vulnerable. So hotel workers, you can imagine, the workers in Chicago were able to organize for panic buttons and basically a hotel blacklist, and got hotels to sign on and say, if you sexually harass a hotel worker, you are not going to stay in any of our hotels. So I will wrap up so that we can pass to Katie and then have some time for Q&A. But I wanted to finish by saying, when we fight against fascism and we fight against militarism, and a lot of our unions are at the forefront of that, when we fight for ourselves to have a democracy, we are fighting for women's health and well-being. And that our power in unions comes from workers building solidarity with each other, coming together and taking collective action with each other, building solidarity with workers who aren't yet in unions, and bridging those gaps and the ways that folks who have access to power, who have access to extreme wealth, try to divide us. And labor also has strategic power. So we saw this during Trump 1.0 when the flight attendants union threatened to stop basically all air travel. They said, we can shut this country down if Trump moves forward with some of the very harmful policies, and they were successful. So labor has incredible strategic power. And it's going to be really important in the days to come that our union leaders are using that strategic power to make sure that our country cannot function until we have justice, until we have an economy that values worker health and well-being, that values working families, and not that values the money that is going to war contractors, the money that is floating to the top in our oligarchy. So I will stop there. I'm looking forward to questions, and I'm going to stop sharing and pass it to Katie. Thank you.
Well, that was extremely powerful. Thank you so much, Elizabeth. I think Cole will be putting my slides up. Welcome, everybody. My name is Katie Murphy. As you heard, I'm the president of the Massachusetts Nurses Association, and I'm an active critical care nurse at the Brigham and Women's Hospital. And I want to thank MAPPA so much for putting this together. It's really both ironic and fitting that we're gathering tonight as advocates for peace in opposition to the waging of war, while just last week, our deranged president and his clown car of advisors have embarked on yet another unnecessary and devastating invasion of a sovereign nation. In just the first few days of this assault, as Elizabeth had mentioned, we believe we are going to be spending $1 billion of taxpayer dollars a day to kill and maim innocent civilians, including the more than 100 school-age girls on the very first day. At the same time, it's estimated that this same madman is expected to spend more than $1 trillion to implement his Gestapo-like program of masked marauders to deport millions of our immigrant brothers and sisters. And it's a true statement that I come to you tonight with a heavy heart, but also with a righteous anger, as well as true appreciation that I and the members I represent are not alone in this commitment to fight this injustice. For tonight's purposes, I've been tasked with providing some insight into how our organization and our union and our members are working to improve the lot of women in our society, which includes our members ourselves. I think the next slide. I want to talk about our perspective, our mission, and our aspirations of the members that I've been elected to serve as president of the MNA. I just want to give a very brief history of the Massachusetts Nurses Association. We were founded in 1903 by 300 nurses, all of them women, who gathered in Faneuil Hall in Boston with the goal of establishing a legal framework to govern the profession, actually creating the designation of registered nurse. In the ensuing years, those nurses passed the Nurse Practice Act, the law establishing registered nursing as an independent profession, created a code of ethics for nursing, and the first uniform curriculum for the education of nurses in the Commonwealth. And over the years, the MNA has been responsible in whole or in part for the passage of every law in our state governing nursing practice, which included the law allowing nurses to form unions in Massachusetts. The next slide. In addition, we were one of the first nurses unions to ensure HIV insurance for nurses working during the HIV/AIDS pandemic and advocated for the compassionate care for all communities impacted by this crisis. And I'm kind of giving the perspective of what we did at MNA, but I think that what we've seen when one organization takes a step, there's a ripple effect. So it's worthwhile starting it in one space and watching it go to other spaces as well. We were a leader among nurses unions to advocate for health and safety languages in our contracts, as Elizabeth mentioned, and the first to mount an aggressive campaign to educate the public and policymakers about the issue of workplace violence against all healthcare workers. In 2010, we passed a law banning the dangerous practice of mandatory overtime. And in 2014, we filed and passed a law setting a safe limit on the number of patients under a nurse's care in the ICU and other critical care units. And when the Bush administration attempted to mandate smallpox vaccination among healthcare workers as a scare tactic in the run-up to the war in Iraq, the MNA was one of the first healthcare organizations to publicly oppose the program without the safeguards we felt were necessary. And finally, the MNA, like many nursing and healthcare unions, were on the front lines of care, as well as calling for safe policies and adequate PPE during the COVID pandemic. Next slide. Our organization is the professional association and largest union for registered nurses and allied health professionals in our state, and the third largest in the nation. We have more than 26,000 members working in more than 85 different facilities, including hospitals, VNAs, schools, nursing homes, group homes, public health departments, and clinics from Cape Cod to the Berkshires. Next slide. Nearly all of our members are working on the front lines in these settings. And these are the nurses who provide 90% of the clinical care patients and clients receive in Massachusetts. As such, our members see more, know more, and have the best understanding of anyone in the healthcare system about how the system actually works, where and how it fails patients, and if given the voice and the power to do so, to propose and foster the changes that are required to improve the system and access to care for all who need it. Next slide, please. In thinking about how to most succinctly and clearly state the mission of our members and our organization, it's this. Our mission is to preserve, protect, and enhance the nurse and healthcare professional / patient relationship wherever that relationship is established. Wherever and whenever a nurse encounters his or her patient, our goal is to work to ensure that nurses and health professionals have the staffing, the resources, the working conditions, the legal framework, and yes, the pay and benefits that allow them to provide the best care possible to those patients. And if those elements are not in place, our goal is to fight like hell to ensure that they are. For hospital staff nurses, this means, I've lost my notes there. For hospital staff nurses, this means a safe patient assignment supported by decades of peer-reviewed research that allows her the time to provide the care that patient receives. For the school nurse, it means having the staff to safely meet the needs, including those kids with special needs and complicated conditions, to keep them healthy, in school, and ready to learn. In our VNAs, it means those nurses and allied health professionals have the appropriate number of visits, including security protections and other tools to allow them the time to care for vulnerable patients in their homes. And for all nurses and healthcare professionals, it means being active in their communities, politically and socially, to address those social determinants of health that harm our families and our communities. Next slide, please. As a union representing direct caregivers, there's a powerful symmetry between what we do for our members as a union and what that means for our patients and for broader society. When nurses have adequate pay and benefits, they're more likely to stay in their respective positions. And the longer they stay in those positions, the better they are in providing the care their patients and their communities need. When we fight, as we have, for landmark contract language to address issues like the use of mandatory overtime as a staffing tool, you, the patient, benefit because you're cared for by a nurse who's well rested, a nurse who has the energy to apply his or her unique skill and knowledge to keep you safe. When we organize nurses and other healthcare professionals into our union, we provide them with the resources and support they need to work collectively to take on even the biggest conglomerates for the resources and working conditions they need to provide optimum patient care and a work-life balance that allows them to be better parents, family members, neighbors, and social justice advocates. I think the next slide. For nurses, which remains a profession dominated by women, unions provide a powerful vehicle for harnessing the compassion and wisdom of nurses to provide a unique perspective and focus for our advocacy. Our members, by virtue of the makeup of our profession and the struggles they have endured, provide a different voice in the marketplace of ideas about what constitutes an equitable and respectful workplace and what constitutes a safe community. A byproduct of the work that nurses do is a level of unrivaled trust by members of the public, as nurses every year, save one, rank at the very top of the Gallup organization's poll of the most trusted profession. In addition to our work as a union, as I stated earlier, the MNA has been a powerful advocate in the public policy arena. As such, I just wanted to focus on some of the current legislation we have that's very, very important to our members, working women, patients, and communities. The next slide. Among these issues is workplace violence, high patient loads, and the ongoing hospital and unit closures, which affects every single one of us. Earlier, I mentioned our efforts through collective bargaining to advocate for the health and safety of all healthcare workers, and specifically the issue of the epidemic of workplace violence in healthcare. The next slide. In Massachusetts, every 38 minutes, in a Massachusetts healthcare facility, someone, most likely a clinician or an employee, is either physically assaulted, endures verbal abuse, or is threatened. And this is really increased from a few years ago. Nurses and nurses' aides are assaulted on the job more than any other workers, save for police officers and prison guards. Kind of sobering. The next slide. This is traumatic for staff who experience it and traumatic for staff and patients who witness it. But this session, the MNA, the Massachusetts Health and Hospital Association, think of that, and SEIU 1199 have come together behind a single bill to address workplace violence. And we just really feel that it has to pass this session. Next slide. I'd like to just talk briefly about patient safety and safe patient limits. Oops, that's workplace violence again. I think it's the next slide. Research and data have been clear for decades. Couple of workplace
Seems
violence
like the slides aren't quite aligned with what you're.
I know.
You know what? Somehow,
I knew there were two sets of slides. I think we'll catch up. This is more, we people in Massachusetts, I'm sure, are clear on, our research and the data that's been out there for decades, that there's almost no greater effect on patient care than the number of patients your nurses caring for at any one time. And, as I said earlier, about 90% of your care is provided by a nurse. And very simply, if that nurse is caring for too many patients, patient care will suffer. And these can have debilitating complications that include medical errors, unnecessary hospital readmissions, and even patient deaths. There's a slide, maybe it's a little bit later. I'm sorry, I feel like they're a little out of order, talking about how, again, if for every patient that your nurse has over safe level, mortality increases by 7%. And we're working on that. Also in the legislature to secure those limits. And this would be set by DPH after hearings with stakeholders, because the limits would be different depending on the area. The limits would be different in an emergency department versus labor and delivery. So we're also working on that legislation. You know, unfortunately, many of the much of our care is made by decision makers far from the bedside. Our other very important issue, and I think there was a slide about hospital closures, is we are seeing that in Massachusetts, just constantly. You've seen it in the paper, and we are fighting to pass legislation to protect the unwarranted closure of hospitals and other essential services. And as you can see, in the past 15 years, we've lost more than 40 vital hospital services, including entire hospitals. And it's important to note that the vast majority of these closures have disproportionately impacted communities serving BIPOC residents and other strategically marginalized communities, and with a significantly negative impact on women and children. I think there's a slide, the next one, that shows the closure of the Tufts inpatient services for pediatric patients. And this one shows the closure of 11 maternity units in Massachusetts over the last 15 years, closures that have caused what the March of Dimes calls maternity deserts. And these closures result in mothers having to travel longer distances for care. And when that service closes, these communities lose access to obstetricians. And all of this has resulted, according to recent reports by DPH, in Black and brown women suffering maternal complications and infant mortality rates 2 to 3 times higher than white mothers and newborns. In nearly every single one of these closures, the DPH, after holding public hearings on each closure, concluded that these services were indeed essential to the public health of the communities they serve and should not be closed. Unfortunately, under current state law, DPH has no power to stop these closures. And as a result, the providers went ahead and closed those services. Public health and safety be damned. So we are still working on legislation this session as well with Senator Sear and a couple of representatives to strengthen our essential service process. And we're asking for an extended notice period, additional community involvement, and policies that penalize hospitals from going against a DPH recommendation regarding the need for a specific service or facility. But all of this activity and activism on our part is overshadowed and undermined by what's happening on the federal level, whether it be the cuts to Medicaid and Medicare flowing from the woefully misnamed Big Beautiful Bill, the impact on our communities by the pending surge in ICE deportation efforts, or the impact on our economy by the Trump tariff policies and the waging of an expensive and unnecessary war in the Mideast. In the healthcare arena, we're already seeing actions by the industry and state government to seek cuts to resources and services to deal with the budgetary shortfall of these decisions that will impact the security of our members and other workers, and more importantly, to the communities that we serve. And women stand to be the hardest hit by these cuts, particularly the cuts to Medicaid. Approximately 19 to 20% of adult women, or nearly 1 in 5, rely on Medicaid for health insurance coverage. Women comprise the majority of adult Medicaid population, accounting for roughly 52% of all enrollees, due to higher rates of poverty and eligibility for programs like maternity care. In fact, Medicaid is the primary payer for maternity care, covering over 41% of all births. Should I be moving? All right, I'm gonna just kind of skip towards the end about where, the federal cuts. We really believe that working together as we are tonight, and we are confident that we can and will bend the arc of history towards justice for all. And I think at this critical time, there's room for absolutely everybody to take action. Show up on a picket line. When you learn that a service is in peril in your community, raise your voice. Tell the decision makers that that service or that school or that facility is too beneficial to your community and it must not be closed. An email, a phone call, a sign on your lawn shows solidarity with our communities. We've been in these fights and we're in them now. Showing up and speaking up puts the power back in our hands where it belongs. And thank you so much.
Thank you to our speakers. You have certainly given us a lot to think about and a lot to consider as we're doing our actions. Bonnie, do you want to summarize some of the questions for us that have come up in the chat? And Bonnie, you're on mute.
We have a crisis in Massachusetts particularly, but across the country, it's the same crisis. We have an aging population, and the nursing homes are going to be closing. And the owners of these nursing homes, mostly private, I'm hoping that the bosses are going to be able to say, you know, this is not in our best interest. We're deporting. I mean, the folks from Haiti are servicing all of Massachusetts hospitals, and is the business community coming together to say, hey, wait a minute, this is not in our best interest. You know, we're not going to be able to provide services to folks, or we'll all be nurses, I guess, assisted electronics nurses. But at any rate, that's my question. Is there any, is the business community coming together and saying, this is nuts. We're just cutting off our nose to spite our face. Any thoughts?
I can speak
Yeah.
to that.
Yeah.
So I would say mostly, unfortunately, not. And that has a lot to do with the ways in which, I mean, unfortunately, I think our country cannot function without low-wage immigrant labor in our
Oh,
food
absolutely.
chains,
can't.
in our
No.
healthcare chains,
Mhm.
in our home care. And so, you know, there are very few penalties for employers who are bringing in labor, having just absolutely atrocious working conditions. And, you know, it was really interesting in last year after Trump got elected, where some of the folks on the right started to say, well, we want you to cut H-2A and H-2B visas. H-2A is agricultural, and some seasonal workers. H-2B is usually higher paid and they're more in like tech and research. And
Right.
all of a sudden, Elon Musk says, and Trump both say, well, actually, we don't want to cut H-2B visas because we need them to run our sector. And the far right says, wait a minute, we elected you because we thought you were a hardliner on immigration. And so it was this really interesting fault line moment. But when it comes to like H-2A workers in agriculture or meat packing would be another really strong example.
Oh, yeah.
So like during COVID, right, Trump says, well, I'm going to declare meatpacking an essential industry, which means that all of the meatpacking plants are going to stay open. And at the same time, we're going to deport those workers en masse. When that happens, those employers don't care because they will bring in a new batch of immigrant workers and churn through them. So unfortunately, because there are no penalties, there are penalties for workers who don't have work authorization. There are not penalties, meaningful penalties for employers who don't have employees with proper work authorization. And so they are benefiting from low wage immigrant labor. When those workers get deported, they're able to replace them with new workers, and that's
Really
not
that
their
easy.
concern. Yeah.
I think I'll just add quickly from the healthcare perspective is I'm hearing from members all over the Commonwealth and all over the country that actually businesses, they do not care that patients will be suffering, that there are not enough workers to provide that care. If once whether it's a nursing home, a group home, or home health care. If there were once 5 workers, well, now the work is going to stay the same, but there are going to be 4 workers. And so the revenue is still going to go into the boss's pocket. But now fewer people are going to be doing more work. And, and the bottom line is, without a doubt, people will die.
Yes, yeah. The predictions are there and they're already happening for sure. There's a question on the issue of solidarity as a key aspect of union activity, and either or both of you comment on how it's being fostered here in Massachusetts and US,
Do you want to start, Katie?
particularly in the Trump administration, the tangerine terrorist.
Oh, I think that that's really our strength. There are more of us than there are of them. And I think that whether it's, supporting the baristas at your local Starbucks where there might
Right,
be 3 workers,
yeah.
just trying to not go there,
Yeah,
give them,
don't cross
stop
the
by,
picket
give
line.
them some support. And, very recently the residents at Mass General Brigham organized, and that was a conglomerate,
Right, exactly.
wealthy, deep pocket. And so we worked very closely with them, because you can imagine this was a workforce, very smart, maybe not very labor oriented, but also a turnover. So you didn't even have, like, whereas, on a factory floor, you might have the same folks there for decades. These residents were turning over. So we actually, from the Mass Nurses Association, we worked very closely with them, providing meeting space, providing support, wearing buttons, just always showing the boss, oh no, we're right here with them, supporting them. And I mean, granted, that's local, not necessarily an exploited group, but actually, even though they were physicians with maybe a high earning ceiling, they're still very exploited. They really are. So I think any place, right? Any place that we can show solidarity.
That's great.
And then I'm sure
across the unions. Yep.
I
Yep.
think one of the nice things about being a labor educator is I get to see workers in all different sectors talking to each other. And so there's some really interesting kind of like mass education projects happening right now as well. So I'm a member of the Merrimack Valley Central Labor Council. They partnered on Saturday with the North Shore Labor Council to put on a day-long conference for union members about understanding the threat of fascism and authoritarianism.
Oh, good.
We
That's
do women's summer schools that are regional for women and unions and workers organizations. And we do things like talk about what's in Project 2025. And, there's a lot of interesting moments where I had a class once where there were some women from the steelworkers and some women from 1199, so home care workers. And one group was saying, we had to go out and work during the pandemic and it was horrible and we were taken advantage of. And another group was saying we wanted to work and we couldn't work and we had to sit home. And it was this moment where everybody realizes that everybody is being taken advantage of.
Yep.
And the people who are winning are the bosses who continue to make record profits.
Yep.
There's a program, there's a couple of like mass education programs specifically about understanding fascism and understanding that the erosion of democracy benefits the billionaire class and does not benefit working people. And so regardless of who you voted for and whose stories you believed during the election, understanding now that what is happening is a direct threat to your rights as a worker and to your livelihood. And so building opportunities for workers to have conversations with each other that are bridging the divide of some of that like extreme polarization that we're seeing right now. So there's a lot of different programs that are happening.
Excellent.
Still
That's
probably
good
not
to
enough.
hear. Yes, not enough, never enough. But here's a question for Katie about for both of you. This can administration. There's been a proposal for administrations and educational grants for nursing graduates, nursing students. What's the status on that?
Well, We're no-
Excuse me.
We're no longer professionals.
Oh, that's true. They've taken away our title as well. Yes, that's right. But hopefully, is the nursing student program being cut? Has the funding been totally cut?
I think there are caps on it. And I think it's more for grad students. I'm sorry, I haven't thought
Oh.
about it in a while. I think but you know, in so many places, right, there are physician shortages, and anybody who's, you know, gotten care from a nurse
Yeah.
practitioner or a clinical
Yeah.
nurse specialist, you know, the care is excellent. And we are not a profession that traditionally comes from wealth, and we need these grants and we need these scholarships to further our education. Again, that
Yeah.
benefits absolutely everybody. And
Everyone.
so
Yeah.
that's what taking this away has decreased our ability to access those monies. And that's simplified. I'm sorry, I don't have like all the details.
Oh,
But
no,
yeah,
no, don't. I wouldn't worry
but
about it. Yeah.
again, it affects, you know, this is so many people. It's boosted them, you know, into, you
Oh,
know,
yes,
the
absolutely.
right,
Into the
and,
middle
you know, into the
class.
middle
Yes.
class,
Yep.
right, and yet and then it provides a service to all communities.
Mm.
So this is a lose-lose.
Right. Exactly. Well, the big beautiful bill is
Oh,
just huge losses, and we are fighting on that front. What we would like to do is get the fact sheets for your bills, and we will send them out to everybody
okay.
and pass them on to various networks so that we've got a large advocacy group that can respond to the Massachusetts bills, particularly because they have a chance of passing if we put enough pressure on the Massachusetts legislature. So, are there other questions that anybody has proposed that I'm not reading here? And do you guys have any questions for us? We love your slides and we'd like to be able to share those with the members. So that's approved for that. That's great. Any questions for Elizabeth?
Well, I will say I put in the chat, if you are trying to figure out how to get access to, like, how do you find out when something's happening? You can follow unions on social media. The Mass AFL-CIO is a great place to start. The MNA has really robust social media. Certainly, like, your community's teachers union is also a really important one. The teachers always know what's going
Right.
on
Oh,
in
that's
community
right.
hospitals
There, yeah.
that are still
And
left.
labor
Yeah,
for single payer is our heart
yes.
and soul as well
Yeah.
on the healthcare front. So
The
those are
nurses have
good
been doing
ideas.
such great
Yes.
work
Oh, yeah.
on that.
They have over many years. And Katie, you've been fabulous forever. And Elizabeth, we're thrilled to have you on
right,
board.
This was so
Yes,
much
and no
fun. Yeah.
young leader. That is so
yes.
exciting, really. Yeah.
I will put my email address in the chat as well.
Okay, great.
no,
Yeah.
hearing the history is
Oh, yeah.
it's
It's
critical.
grounded us.
It's
Yeah.
critical, right? To hear the history of where we've been, and hearing the work those women did, those immigrant women, it's
Yeah.
powerful. I can't,
Yeah.
Right.
I can't hear it enough.
I think,
Great.
when I teach the history, it's also important to remember, like, unions haven't always done the right thing. A lot of unions
Right.
have, and a lot of unions have fallen into that divide and conquer logic, and we still see that happening today.
Sure.
Labor isn't a monolith, and so, like, drawing on those really powerful stories is, I think, even more important to say, like, we have a choice about the kind of power that we want to build together and the kind of future for everybody that we want to fight for. And so we can be smarter than falling for those divide and conquer tactics that the wealth owning class has used time and time again on us. And like, we can learn both from our inspirations of the past, and we can also learn from the mistakes. I talk less about those because that's a downer, but but I think
Those
that's
are
really important to
factually
know as well.
correct. Yes,
Yeah.
unfortunately. Rosemary tunes in terms of the crisis in Dorchester. It's still not resolved with Kearney being closed, and that was part of the massive losses with Cerberus capital. So, is there any new news on Kearney replacements or any resolution at all on the hospital status in Massachusetts with the cuts?
There's a working group that brings stakeholders together.
Yeah.
I don't think there have been any resolutions. I mean, every once in a while there's talk of a freestanding emergency or an urgent care or a pharmacy, because a lot of the neighborhood used the pharmacy there. But it's really not making a lot of progress. It really, but people are still at the table, still talking about it. But and yet Ralph De La Torre free and on his yacht and attends
still on his yacht. Yeah.
Yep.
No consequence. Yep.
Right. Whereas that neighborhood has been devastated.
Yes, absolutely, for sure. Sandy, he said we need these essential workers who kept us alive through the pandemic and suffered most, not able to work from home. So we have good sentiments from everybody thanking the speakers. And any questions, Elizabeth, that you have? With the two Elizabeths, Elizabeth Summers.
No, I think you did a great job summarizing them. And I think the real strength of this webinar was not only on providing kind of a historical context, but really giving us some updates and ideas for action. So two of you have really been brilliant, and I want to thank you so much. And to let everyone know who's participating, there will be a fact sheet coming out, resource page in the next couple of days. So you'll be getting that in the email. So look for that.
And Katie, send me the legislative information. We'll make sure to include all that in the resource list.
Great.
Thank you. And thank you so much for putting this on. MAPA does such great work, and everybody, it's inspiring. It's really inspiring because we've got to just keep taking action.
Oh yeah, that's right. We've got 3 more years.
Oh, God. Oh my God.
I hate to end on that note, but I stand to see if somebody's sudden death. But who knows?
It's our call to action. It's our call to action.
It is our call to action. So thanks not only to our speakers, to our audience, thanks to Cole for his technical expertise, and to MAPA for letting us do this. So, there's every reason to be hopeful. It's the tiny drops of water that erode the rock, and we are it. So never underestimate our own power.
That's right. Good inspiration.
Yes.
So thank you all.
Thank you so much. Thanks to everybody who tuned in. Thanks. Enjoy Portugal. Thanks.